Corinne did an internship out in the New England area for a year at a big referral practice out there, and they see a lot of Lyme's disease out there, so she's our new Lyme's expert. And so she was so very willing to do this tonight that we thought we'd let her give the presentation on Lyme's disease.
Thanks, Dean. Like Dean said, my name is Corinne. I probably have not met very many of you. I started in September of 2011, so I missed last year's Lyme Appreciation meeting, unfortunately, but I'm very happy to be here this year, so thank you for having me. Lyme disease in horses.
Can you have a little louder?
Sorry. So, like Dr. Brooks alluded to, Lyme disease is one of the most important arthropod or tick-borne diseases we have in the U.S. Specifically in humans, it's very, very important. It was recognized in humans way before we recognized it in canines and equine clients as well. But more recently, we've realized that we do have quite a large problem with infection. Incidence rates, if you can look at this map that we have here, are very specific to certain regions of the U.S., specific to the East Coast, where I practiced for a year in Vermont, very specific to our area, Wisconsin and Minnesota, and then a very small area in California. A little history on where Lyme disease came from. It was first recognized in 1975, Lyme, Connecticut, hence the name Lyme disease. They basically had this group of children with very mysterious arthritis symptoms. They had no idea really where it was coming from, but through some research and basically a lot of cases, they were able to correlate the fact that these symptoms showed up right about this time that tick season was at its height. Also noticed that a lot of these children lived in wooded areas and had a lot of exposure to ticks. It took several years from the disease recognition to when they were able to actually identify the cause of Lyme disease and discovered it in about 1981. Realized that it was the tick carrying the bacteria that caused the disease. The bacteria was actually discovered by a group of scientists, specifically Dr. Bergdorfer was probably one of the most important ones in the role of the discovery, so hence they named it after him. Very long word, Borrelia burgdorferi. And it's a spirochete bacteria, which is kind of a fancy name for a bacteria that we see. It's thin, elongated, motile, and looks kind of spiral in this shape. I don't think it shows up very well in the back of the room, but when stained correctly, you can kind of see it spiral. They're also very interesting because they're very good at evading the immune system. They like to travel along planes of connective tissue, specifically joints, hence why we see a lot of the signs that we see with Lyme disease. Deer ticks, especially in this area, are the reason that we have a Lyme disease. We're a very endemic area for ticks. They have the bacteria, they pass it along. In our area, Ixodes scapularis is the tick that we see most commonly, also in the East Coast as well. In the West Coast, in the California area that we pointed out on the map, Ixodes pacificus. So clinical signs. So the most common clinical signs that we see as horse owners are very similar to the signs that we see in humans, except for the kind of bullseye rash that we notice in us, because horses have hair, we can't really see their skin as easily as we can on us. But we see the lameness, the pain, basically kind of joint inflammation is kind of what we see. But not all infected horses show the same clinical signs. So we'll have horses with very similar titers, very high titers, when we do test, but they will not have the same clinical signs. One horse will be very, very lame, doesn't want to move. Another horse we won't actually have noticed. We just kind of tested and ended up finding a high titer. I'm not really sure why that is. It seems to be correlated to the difference in how each horse handles the infection. Like I said before, the bacteria, Borrelia, prefers connective tissue. So it travels in areas with very little blood supply. And this really helps it basically protect it from our immune system. So once we're infected, it is really hard for our immune system to rid ourselves of the infection, hence why treatment is really important in this case. Also, having preference for connective tissue is the reason why we see the pathology that we do. Lameness, joint pain, basically are the two most common clinical signs that we see reported. It's very likely due to the fact that the bacteria prefers areas like that. So probably the most exciting development that veterinarians have had when it comes to Lyme disease is a new test out of Cornell University. This only happened in the past few years. This test allows us to differentiate between an early infection and a late infection. And this is really important when it comes to treatment and for us as veterinarians to be able to help the horse. So it's called a multiplex assay. It basically looks at different antibodies that the horse produces in response to infection. Simply, the test basically places fluorescent beads on these different antibodies, and then they measure these beads. This is just a schematic kind of trying to explain how it all works. It's kind of hard to explain the test in its entirety, and if you were interested, there's a whole paper on it that I can give you the link to go read on. But basically, equine serum has antibodies produced due to the infection. Beads are attached to that, and then the test evaluates how many of the fluorescents they have. So the biggest part about this test that's so important to us is that we're measuring 3 different, what we call outer surface proteins that the bacteria produces. And the bacteria produces these proteins depending on the cycle of infection that it's in. So one protein is produced when the bacteria is in the tick before it infects. Another protein is produced during infection, and then a third protein is produced at a chronic stage of infection. And in response to this infection, horses develop antibodies to these outer surface proteins, and that's what we're testing for. This is a great schematic, I think, because it really kind of shows what I was just talking about. So the bacteria, these are the 3 different proteins that we're looking for: OSP-A, OSP-C, and OSP-F. Specifically, OSP-A here is expressed by the bacteria while it's in the tick midgut. It's then downregulated after infection, and then the bacteria upregulates OSP-C during acute infection. And this can be detected 3 to 5 weeks after infection. So that's the first time we can actually detect infection with the test. After a period of time, acute infection, about 7 weeks, it will start downregulating OSP-C, and then the chronic infection protein becomes upregulated, and that's OSP-F. So, I know it's all very complicated, but this is kind of a summary slide. Basically, OSP-A in the tick, OSP-C, acute infection, and OSP-F is the chronic. So when we do a test and we get this big paper back from the lab, and if you guys want to see it, this is basically what we're looking at. So we can basically identify antibodies or infection 3 to 5 weeks after somebody's infected, which is great. I mean, the tests that we had before weren't this specific. So as in our ability to treat and to help diagnose what's wrong with your horse, this is a great tool. Also, what we're able to do is after we determine infection, we'll institute treatment, and then we can retest, and we can look at how the antibodies are decreasing in response to treatment. And this is actually a really challenging area where, because the test is so new, we've only done it so many times, and we're finding that the speed and the degree that the antibodies decrease is variable, and so we're still